Can back pain be psychosomatic? Back pain is one of the most common medical complaints worldwide, affecting people of all ages and lifestyles. Traditionally, it has been attributed to physical causes such as muscle strain, herniated discs, or poor posture. However, a growing body of research and clinical evidence suggests that not all back pain stems from a clear physical source. In many cases, back pain may be psychosomatic, originating from psychological or emotional factors rather than structural abnormalities. This raises an important question: can back pain be psychosomatic? And if so, how? The term psychosomatic refers to physical symptoms that arise from or are significantly influenced by mental or emotional stress. While this doesn't mean the pain is imaginary or all in the head, it does suggest a connection between mind and body. Psychosomatic back pain is real pain, but its origin lies in psychological stressors rather than tissue damage. Factors such as anxiety, depression, trauma, or chronic stress can manifest physically, often targeting vulnerable areas of the body like the lower back. One of the most well-known proponents of the psychosomatic theory of back pain is Dr. John Sarnow, a rehabilitation physician who introduced the concept of tension myositis syndrome (TMS). According to Sarnow, the brain can create pain in order to distract a person from repressed emotional conflicts or stress. In TMS, the brain restricts blood flow to muscles and nerves in the back, leading to pain, numbness, or weakness even though there is no structural damage. While Sarnow's ideas remain controversial in the medical community, many patients have reported significant relief from chronic back pain after addressing emotional issues or changing their beliefs about the pain's origin. Scientific studies have supported the notion that psychological factors can influence the perception and persistence of pain. For example, people with high levels of stress or depression are more likely to report chronic pain and may experience it more intensely. Additionally, the brain's pain processing centers are closely linked with emotional regulation areas, further supporting the idea of a psychosomatic connection. Treatment for psychosomatic back pain often involves addressing the underlying emotional or psychological issues. This can include psychotherapy, cognitive behavioral therapy (CBT), stress reduction techniques, or mindfulness practices. Some patients benefit from journaling or guided self-reflection to uncover hidden sources of emotional tension. In these cases, successful treatment doesn't necessarily involve physical therapy or medication, but rather emotional healing and mental health support. That said, not all back pain is psychosomatic, and it's crucial to rule out physical causes before jumping to psychological explanations. A thorough medical evaluation is necessary to ensure that no structural or medical condition is being overlooked. Psychosomatic. Like, subscribe, follow for your free back pain relief ebook.